Welcome back to the Parkinson's Doctor YouTube channel. This is Dr. Ramon Rodriguez, and I am a neurologist and movement disorder specialist in Orlando, Florida. And I want to take the time today to speak about the challenge that it can be for people with Parkinson's disease to obtain their medications on time if they are in the hospital or if they are in a rehab facility or they are in an assisted living facility. And I want to begin by sharing the experience of two different families, two different patients that have Parkinson's disease. And they have Parkinson's disease for more than 7 or 8 years. So they are a little bit more advanced in their condition of Parkinson's. And in the first situation, what happens is that the husband, the man, he is my patient and he has Parkinson's disease. And he has Parkinson's disease now for 11 or 12 years. And he's taking his medications 5 or 6 times a day. And what happened is that his wife, who is the main caregiver, needs to have surgery. And her doctor tells her that after the surgery, his recommendation is for her to go to rehab for 3 to 4 weeks. And then after that, he does not want her to be doing any heavy lifting or doing any too much activity. And obviously, he tells her that she will need some help to take care of her husband, but he's not recommending her to go back into her caregiving until 8 weeks after the procedure. So obviously this makes things a little bit dicey, but they work it out very well. They decide to have the patient go into an assisted living facility. For those 8 weeks, somebody will be helping him with obtaining the medications, getting their medications on time. And finally the day comes. He goes into the rehab unit. She goes to have her surgery. And for the first 4 to 5 days, everything is working very well. However, when the first weekend comes, what happened is that he's not getting his medications right on time, and the last dose that he's supposed to given at night, he doesn't get it at the timing that he was supposed to, and this results in exacerbation of the tremors. He has some difficulty with speech, and he has some, so he's not able to communicate. Listen, I get like this if I don't get my medication right on time, or the nurse does not understand. And typically what happens in these facilities is that they're always very concerned that the patient might be having something really bad. They might be having a stroke or a heart attack or something like that. So they immediately call the 911. They take the patient into the emergency room. And now the patient spends the whole night, and it delays even more the timing of the patient taking his medication for him to finally get better. So this is something that is completely unnecessary. And the issue is that in a matter of 4 weeks, the same situation happened twice with the same person. So once again, this is something that I hear about in my clinic every day. We get called by somebody that they're having some issues with medication intake if they are in the hospital. So it can be a major challenge. In the second case, a little bit different. This is a female patient. She has a urinary tract infection. The doctor tells her, listen, let's put you into the hospital to give you some IV antibiotics for the next 24 to 48 hours. And then after that, you will be able to go home and just continue your medications orally. This seems to be a little bit of a more complicated urinary tract infection. So when the patient is in the hospital, it turns out that she doesn't get the medication right on time. It's been a little bit over an hour of the timing of her medication intake. And this particular patient, what happens is that she becomes very anxious. And she has a little bit of a problem controlling the situation, or at least expressing herself. So she starts screaming like, you're trying to kill me. You're not giving me my medicines. I need to get my medications for Parkinson's disease. And in the whole situation, it's about 2 or 3 in the morning now. The nursing staff calls the doctor and tells her, listen, we have a patient that is agitated and she's irritable and she's screaming and she's not letting people sleep, the other patients. So obviously, remember, at 2 or 3 in the morning, all you want to do is pass that message right away. And the doctor tells her, well, give him some haloperidol, some Haldol, to calm the patient down, get the patient to sleep, and then tomorrow morning we figure out exactly what is going on. Hopefully everything will be better. But what happened is that we know that Haldol, can aggravate the symptoms of Parkinson's disease because it's a dopamine blocker. So now the patient gets this haloperidol, and it takes more time for her to recover. And what was supposed to be a 2 days admission now takes about a week because now she has the blockade of her dopamine receptor. She's getting her medication for Parkinson's disease, but she's not getting the right benefit that she was expecting, that she typically obtains for her medication. So now it's about a week in the hospital, and then after that, she has to spend 2 or 3 more weeks at the rehab facility before she's able to go home. So once again, these are situations that I hear about almost on a daily basis, and we have patients calling 2 or 3 times per week, asking us as doctors to call the hospital, the assisted living, just to discuss with them how critical it is for them to take their medications on time, right? So let's go ahead and discuss exactly what is happening. The first thing that I want you to understand is that in hospitals and long-term care settings, be aware that these teams, nursing staff and medical assistants and doctors and the whole healthcare system, they have challenges when it comes to administer these Parkinson's medicines optimally. And the reason is that they have a high volume of patients that they have to watch out for. And that person with Parkinson's disease is not the only patient, right? There are some other patients with very complex schedules. Some of them even get intravenous medicine. So it might happen that when the person is supposed to be getting their medicine, not everybody will be getting the medication at the right time. This can be very challenging. It can be very difficult. And I do understand, as a healthcare professional, I understand the challenges that people have in the hospital and that my colleagues have when when they're working in the healthcare facilities or long-term care facilities. And then the other thing that we have to recognize is that people with Parkinson's disease can have cognitive impairment, and because of this, they might become a little bit irritable. They might be frustrated, and then these are symptoms that actually sometimes are aggravated or magnified if they don't take their medication on time. So as you see how things are escalating at this point. So one of the main things that we have been doing is we have been trying to educate healthcare staff about Parkinson's disease and the importance of on-time medication administration. And what happened is that in the early stages of Parkinson's disease, many people have kind of a reserve of dopamine in the brain, when they're taking their medicines. But when Parkinson's disease advances, they're mostly depending on their medicine. So if they don't get the medication right on time, they can have a decrease in the dopamine levels. And obviously, this results in exacerbation of the tremors, more stiffness, more slowness. And we have discussed this before, that some people with Parkinson's disease, many times, they have even pain, they have anxiety. Some people can have even panic attacks. So as you can see, some of the things continue to aggravate depending on the particular patient. Let me tell you that the other situation that I see in my clinic is this. So typically, the hospital will have generic medicine. So they will have carbidopa, levodopa, they will have pramipexole, ropinirole, rasagiline. They even though it's a generic medicine, they might not. And the newer medicines that we have for Parkinson's disease, and now I'm talking about Rytary, I'm talking about Gocovri, I'm talking about Norians, I'm talking about Apoquine, right? So most times, hospitals do not have these medicines in their formulary. So what is going to happen is that when a person with Parkinson's disease that is taking these medicines go into the hospital because they fell down, they hit their head or whatever happened, chances are that those medicines are going to be replaced by something else, and that something else that they are replaced with is not the same, right? It might not work for them the same way that all these other branded medicines have been working. So this is a major issue, and it is at this time that not only they are not getting the right medicine for Parkinson's disease, but in the convoluted situation where there might be some sort of agitation or other problems, they might actually end up getting a medicine that is contraindicated, right? So now things are getting even worse. It's like snowballing, right? So what can we do? How can we address this situation? So in first place, it is critical that you as a patient and along with your caregiver have a list of the medicines that you are taking, all of them. Not only the ones for Parkinson's disease, but you need to have a list of all the medicines that you take with the dose of the medication that you are taking. And then you need to have the timing. I take this medicine not in the morning. You have to say, I take this medicine at 8 a.m. I take this medication at 12 noon. I take this other medicine at 4 p.m. and the other ones at 8 p.m. I want you to avoid doing I take this medicine 4 times a day, right? Because that doesn't provide the necessary information for you to be able to get this medicine right on time. So it's not like I take one in the morning and 3 in the afternoon. That is not going to work. That is not going to cut it. So you have to make sure that you're bringing a very detailed list of medicines with the dose and the timing that you are taking that particular medication. So that would be number one. Number two is if you're taking a medication that is a branded medicine, make sure that you bring at least 1 week of that medicine with you. Because it might be possible that the hospital does not have that medicine in the formulary. And I'll tell you that this is very common with medicines like Rytary, which is one of the extended release formulations of carbidopa levodopa. And it could happen as well with a medicine called Gocovri, which is the extended release formulation of hemantidine. So they are not going to have this medicine most likely unless this is a facility that understand what Parkinson's disease is, and they're used to have a large amount of patients with Parkinson's disease going to their facilities. But I am going to tell you, I have been doing this job for over 20 years, and I can tell you that I can count with the fingers of one hand the institution is the United States that I think will have those kinds of medicines. So the easiest way, what you need to do is just have a small kit. And this is where that Aware in Care kit from the Parkinson Foundations becomes quite handy. You need to have a kit where you have these medicines with you, and you will be able to take them. So they have some time to get this medication with their local supplier, and they will be able to continue giving you this medicine. Now, the important thing is that the idea is not for you to take the medicine with you and you're going to take it, right from the bottle in the room with you. You need to surrender those medicines to the nurse and let them make the decision to figure out what is the easiest way of doing this, right? So how, what we ended up doing in our clinic neurology one to deal with this situation. So in first place, we have made our teams available to educate healthcare staff in the local hospitals in our area. And we're actually more than happy to go to long-term care facilities to explain the local teams the challenges that people with Parkinson's disease have when it comes to getting their medicine. Because what happened is that for them, it is all good as long as they have an hour before or after to give the medicine. But this might not be just right when it comes to a person with Parkinson's disease. So there has to be a little bit more of meticulous planning. In this case, I want to make sure that there is an open line of communication among the patients, caregivers, and the healthcare providers, the nursing staff, and the facility. And whenever this happens, things tend to be better. The other thing is that, with all these situations that we were having, remember that it is extremely difficult for me to call every facility when one of our patients end up in the hospital or one of these assisted living facilities or rehab units, just because we have too many people and it takes time to be able to communicate. So what we ended up doing is we created a letter that is coming from us, right? And we provide it to our patients now when they go to the hospital. And what we ask our patients is to give this letter to the healthcare team. And it explains exactly what is happening. in a short paragraph explains why it is so critical for them to get their medication right on time. And then we added a second paragraph about the medications that they need to avoid to make sure that we do not exacerbate the symptoms of Parkinson's disease. So what I'm going to do is I am going to, to put the sample of the letter that we use in our clinic. Obviously, you can talk to your doctor. If you're a patient in our clinic, just come. We'll make sure that we get this kind of information for you. But I want you to have an idea about what the letter says. You might be able to share this information with your doctor, or at some point we're trying to figure out how to write something that other people that might not be our patients might be able to download, and they might be able to use it if they end up in the hospital, if it happens that their local doctor is not able to provide something like this. I hope that you learned something from this. I want to make sure that you also connect with our blog. So in the blog, actually, we have a copy of the letter. Our blog is www.learnaboutparkinson.com. And right there, you're going to find this video, and you will find many other videos as well. And you actually will find a summary of this presentation. So we have the main concepts of this video written, so you might be able to print them out and maybe discuss them with your doctor, or discuss them with your other family members. I really hope that you learned something from this. I really hope that we are able to avoid some of the complications of people with Parkinson's disease not getting their medicines. And I have to tell you that at the same time, I want to commend some of these big organizations, in this case, particularly the Parkinson Foundation, for their Aware in Care kit that has some of this information as well as some other resources to help you prepare whenever you need to go to the hospital. Thank you very much for your attention. I really hope that you find this helpful. Please make sure that you subscribe to the channel, so whenever the next video is available, you will be able to access it immediately. Thank you very much, and I wish you a wonderful week. Thank you.